How does CF genetic inheritance work? Imagine your genes as a set of instructions that determine how your body works. Cystic fibrosis is inherited through a pattern called autosomal recessive inheritance. This means a person needs to inherit two faulty copies of the CFTR gene, one from each parent, to develop the disease. The CFTR gene is responsible for making a protein that controls the movement of chloride ions and water in and out of cells. This process is crucial for producing mucus that is thin and free-flowing. When both copies of the gene are mutated, the protein doesn't work properly or isn't made at all, leading to the thick, sticky mucus seen in cystic fibrosis. If someone inherits only one mutated CFTR gene and one normal gene, they are called a carrier. Carriers usually do not have symptoms of cystic fibrosis but can pass the mutated gene to their children. When two carriers have a child, there are several possibilities. There is a 1 in 4 chance that the child will inherit two mutated genes and have cystic fibrosis. There is a 1 in 2 chance that the child will inherit one mutated gene and be a carrier, without symptoms. And there is a 1 in 4 chance that the child will inherit two normal genes, meaning they are neither affected nor carriers. If a person with cystic fibrosis, who has two mutated genes, has a child with a carrier, each child has a 50-50 chance of inheriting cystic fibrosis or being a carrier. It's important to remember that each pregnancy is independent, so siblings can have different genetic outcomes. The specific mutations in the CFTR gene can vary widely. Some mutations stop the protein from being made at all, others produce defective proteins that don't work properly, and some reduce the amount or stability of the protein. This genetic variability explains why symptoms and severity can differ among individuals with cystic fibrosis. In summary, cystic fibrosis inheritance depends on receiving two defective copies of the CFTR gene, one from each parent, following an autosomal recessive pattern. Carriers are healthy but can pass the mutation to their children. This is why genetic testing and counseling are so important, especially for families with a history of CF. Understanding this pattern helps families make informed decisions about health and family planning. It's always best to consult healthcare professionals for personalized advice and testing options. This knowledge is based on current scientific understanding and helps us appreciate how genetics shape health from the very beginning of life.